Welcome to this Step 3 review on common outpatient complaints and the test-taking strategies that will help you crush them on exam day. This video is brought to you by Roadmap to Residency. Step 3 loves the outpatient setting, and today we are focusing on 4 of the most heavily tested complaints you will see: fatigue, chronic cough, insomnia, and weight management counseling. Now, here is the most important thing to understand. We are not here to reteach every detail of these topics from scratch. Instead, we are going to train your eye to recognize the exact question patterns the exam writers use and give you a repeatable strategy to land on the right answer quickly and confidently. The best way to truly master this material is to learn it through the experience of working questions. So as we go, make sure you are reviewing the ambulatory medicine and outpatient chapters of your main board review book and working through related questions in your question bank. Let us get started. Here is what we are going to cover today. First, we will learn how to recognize the high-yield question stems for fatigue, chronic cough, insomnia, and weight management counseling. These 4 complaints show up constantly in the outpatient questions on Step 3. Second, we will apply specific test-taking strategies for the fatigue workup and the chronic cough question, because those 2 patterns trip up more students than almost anything else. Third, we will master the next best step format, which is the exact phrasing the exam uses for insomnia management and for weight management counseling. This video assumes you have some baseline knowledge from your review resources, so review the ambulatory medicine chapters of your main board review book and work the matching questions in your question bank. We are here to sharpen the way you attack these questions on test day. Our first strategy is the fatigue workup split. Fatigue questions feel intimidating because the differential is enormous, but the exam is really testing one decision. Do you take a focused history first, or do you reach for testing? When you see a fatigue stem, immediately scan for red flag features. If you see unintentional weight loss, fever, night sweats, or a focal abnormal finding on exam, that pushes you toward an organic workup. If instead you see a pure psychosocial story, recent stress, poor sleep, low mood, and a completely normal exam, the answer is far more likely to involve screening for depression or addressing sleep rather than ordering a panel of tests. Now, when the question does ask for the next best test, anchor on the high-value first-line panel, a complete blood count, a thyroid-stimulating hormone level, and a basic metabolic panel. The single most common trap here is the shotgun answer choice that orders many expensive tests at once. The exam consistently rewards the targeted, cost-conscious workup, so make that your default. For the full differential, review the fatigue and ambulatory medicine sections of your board review book. Strategy 2 is the chronic cough top 3. The first move on any cough question is to check the duration. A cough lasting more than 8 weeks is chronic, and that single word reframes the entire question. In a non-smoker with a normal chest film, the answer is almost always one of 3 causes: upper airway cough syndrome, which you may know as post-nasal drip, asthma, or gastroesophageal reflux disease. Here is the test-taking key. Before you commit to one of those 3, scan the stem for a trap. If the patient is on a blood pressure medication ending in the letters P, R, I, L, that is a drug-induced cough, and the answer is simply to stop the medication. If you see a smoker with hemoptysis or weight loss, the question is no longer about the common causes. It is steering you toward chest imaging to rule out something serious. Once the red flags are cleared, the exam rewards empiric treatment of the single most likely cause before ordering an expensive workup. Review the chronic cough algorithm in your board review book to lock in the order of steps. Now let us train your eye on stem recognition for 3 more of our complaints. For fatigue, the classic stem describes someone tired for months with a normal exam and no red flags. Watch for the small clues planted in the stem. A woman with heavy menstrual periods is pointing you toward iron deficiency, while cold intolerance and weight gain point toward low thyroid function. The first line panel is a complete blood count and a thyroid-stimulating hormone level. For insomnia, the stem describes trouble falling or staying asleep for several weeks with daytime impairment. The single most important test-taking point here is that the exam wants sleep hygiene and cognitive behavioral therapy for insomnia as the first step, not a sleeping pill. Always screen for caffeine, alcohol, depression, and an underlying medical cause before treating. For weight management, the stem is a patient with an elevated body mass index asking how to lose weight. The first step is always intensive lifestyle change with diet, physical activity, and behavioral counseling. Medication and surgery come later and only at defined body mass index thresholds. The exam is testing whether you know the correct order of these steps. These stems repeat over and over, so the more questions you work, the faster you will spot them. Let us work through our first practice question. A 28-year-old woman reports 3 months of tiredness. She works long hours but sleeps 7 hours a night. She has heavy menstrual periods and craves ice. Her exam shows mild pallor and is otherwise normal, and her vital signs are normal. The question asks for the most appropriate next step. Your options are: order a complete blood count and ferritin, order magnetic resonance imaging of the brain, reassure her and recommend more rest, or begin an antidepressant medication. Look closely at the clues planted in this stem before we walk through the answer together on the next slide. Here is our second practice question, and this one is about chronic cough. A 54-year-old man has had a dry cough for 3 months. He never smoked. He started a new blood pressure medication, lisinopril, 4 months ago. His chest film and his lung exam are both normal. He has no heartburn, no post-nasal drip, and no wheezing. The question asks for the most appropriate next step. Your options are: stop the lisinopril, order computed tomography of the chest, start an inhaled corticosteroid, or begin a proton pump inhibitor. The timeline in this stem is doing a lot of work, so think carefully about what changed right before the cough began. We will walk through the answer next. Let us work through this answer. First, read the timeline carefully, because the timeline is the whole question. The cough began right after the patient started a blood pressure medication ending in the letters P, R, I, L. That class of medication is a classic and very common cause of a dry, nagging cough. Just as important, scan for red flags and notice there are none. He never smoked, his chest film is normal, his lung exam is normal, and he has none of the symptoms of the 3 common causes, so there is no post-nasal drip, no wheezing, and no heartburn. Now, why does stopping the medication win? Because the board rule is simple. When a drug is the likely cause, you remove the offending agent first, before you order tests or pile on new treatments. Choice B, computed tomography of the chest, is the expensive imaging trap, and it is wrong when the film is normal and there are no red flags. Choice C, an inhaled corticosteroid, treats asthma, and choice D, a proton pump inhibitor, treats reflux, but the stem specifically told you the patient has neither. The correct answer is A, stop the lisinopril. Working questions like this is how you train yourself to catch the medication clue instantly. Let us review Insomnia Management for the boards, because the exam tests the order of treatment, not memorization of drug doses. Here is the most important point in this entire video for insomnia. The first-line treatment for chronic insomnia is cognitive behavioral therapy for insomnia paired with good sleep hygiene. Whenever you see an answer choice offering this non-drug behavioral approach, it is almost always the correct answer over any sleeping pill. Before even that, the exam wants you to screen for and remove the obvious culprits: caffeine, alcohol, an underlying medical problem, and a mood disorder like depression. Now, when does medication come in? Only short-term, and only after behavioral therapy has been tried and failed. When the boards do pick a drug, they favor a short course of a non-benzodiazepine sleep aid or low-dose doxepin. And here is a classic trap to avoid: long-term benzodiazepines, especially in older adults, because they raise the risk of falls and confusion. In fact, recognizing that you should avoid that class in an elderly patient is frequently the answer itself. To reinforce all of this, work through the sleep and ambulatory medicine questions in your question bank. Here is our third practice question, this time on insomnia. A 45-year-old woman reports 2 months of trouble falling asleep and daytime fatigue. She drinks 3 cups of coffee in the evening and she scrolls on her phone in bed. She has no depression and a completely normal exam. She is asking you for help. The question asks for the most appropriate next step. Your options are: prescribe zolpidem nightly, counsel on sleep hygiene first, prescribe a nightly benzodiazepine, or order an overnight sleep study. Pay close attention to the habits described in this stem, because they are pointing you straight at the answer. We will walk through it next. Let us break down this answer. First, spot the modifiable habits. The stem deliberately plants 2 fixable behaviors. She drinks coffee in the evening and she scrolls on her phone in bed. Add in the fact that she has no depression and a normal exam, and this is a straightforward case of chronic insomnia driven by poor sleep habits. The question is steering you toward addressing behavior before reaching for any pill. Now, know the board rule. Sleep hygiene and cognitive behavioral therapy for insomnia are always first line. Choice A, zolpidem, and choice C, a benzodiazepine, are later options that are meant to be short-term, and the benzodiazepine is especially risky over the long run. Choice D, an overnight sleep study, is for when you suspect sleep apnea, which this patient does not have. The correct answer is B, counsel on sleep hygiene first. This is the highest yield insomnia pattern on the exam, so commit it to memory. Let us close out our practice questions with weight management counseling. Here is the question. A 40-year-old man with a body mass index of 32 and no other medical conditions asks you how to lose weight. He has never tried a structured program. What is the most appropriate first step? Your choices are: refer him for bariatric surgery, start a weight loss medication, recommend intensive lifestyle change with diet, physical activity, and behavioral counseling, or simply advise him to eat less. The answer is intensive lifestyle change with structured diet, activity, and behavioral counseling. This is always the first step at any elevated body mass index. Watch the trap of the vague advice to just eat less, because that is not the structured, evidence-based counseling the exam is looking for. Now learn the thresholds and the order, because the exam loves to test them. Weight loss medication is reserved for a body mass index of 30 or higher, and only after lifestyle change has been tried and failed. Bariatric surgery generally requires a body mass index of 40 or 35 when there is a weight-related condition such as diabetes. Lifestyle first, then medication, then surgery. Know that order cold and reinforce it by working nutrition and preventive medicine questions in your question bank. That wraps up our review of common outpatient complaints and the test-taking strategies for Step 3. Let us recap the big ideas. For fatigue, take a focused history first and favor the targeted, cost-conscious workup over the shotgun panel. For chronic cough, clear the red flags and the medication clue, then think of the 3 usual causes. For insomnia, behavioral therapy and sleep hygiene come before any pill. And for weight management, the order is always lifestyle change first, then medication, then surgery, with the body mass index thresholds memorized. The single best way to lock all of this in is to learn it through the experience of working questions. So head into your question bank and the ambulatory medicine chapters of your board review book and apply these strategies. If you found this video helpful, please like it and subscribe to the channel so you do not miss our next board review session. And be sure to visit roadmaptoresidency.com to check out our expert tutors and residency advisors who can build a personalized study plan around exactly these patterns. Good luck on your exam, and we will see you in the next video.